Welcome everybody to the Houston Acupuncture video series, and today we're doing temporomandibular joint disorders. You may have heard of the term TMJ, and TMJ refers to the temporomandibular joint, and temporomandibular joint disorders are when you have problems with the joint. Now, the temporomandibular joint is located on both sides of your face, right in front of your ears, and this is the joint that helps us function our jaws. So it helps you open and close your mouth. You use it when you're speaking. And problems with this joint can cause a variety of symptoms. We can have pain. Sometimes people can have a popping or a clicking sound that comes from their joint. You can have a locked sensation, like you just can't open it. It feels like it gets stuck. These are all different types of symptoms that patients who have temporomandibular joint disorder may have. It's actually pretty common. It's estimated that about 5 to 10% of people have temporomandibular joint disorder. So that's almost 1 in 10 to 1 in 20 people that have it. And it's most common in people ages 20 to 40. It tends to be a little more common in women as well compared to men. Now, from a Western perspective, there's not really a clear single identified etiology of what causes temporomandibular joint disorders. It's thought it could be from prior joint trauma. Maybe you had some sort of injury to the jaw. It could be arthritis. It could be from teeth grinding. It could be from malocclusion where your teeth are not properly aligned, but there's not really a clearly identified single cause. You may have some of those in your history or none of those at all. But regardless of that, from a Western standpoint, there's a few options that we use for treatment. From medication wise, you usually start with kind of over the counter things like Tylenol, ibuprofen. And then there's also additional non-surgical and non-medical things that you can do, like oral splints or mouth guards. If it gets more severe than that, you might be recommended to do trigger point injections using either steroids or Botox. And then in severe refractory cases, there are surgical options that are available as well. But what I really want to spend our time today looking at is how do we treat TMD from an Eastern perspective, because that's what you guys are here for, and that's what you want to hear me talk about. And so we have a baseline understanding of it from a Western perspective and with the anatomy, and now we're going to add on to that kind of an Eastern perspective and how we view it from an Eastern and Chinese medicine lens, and how we can use acupuncture and herbal medicine to help treat temporomandibular joint disorders. All right, now to have a understanding of temporomandibular joint disorders from a Chinese medicine perspective, we need to understand the anatomy from an Eastern perspective as well. It's similar in many ways, but it's also vastly different. In Chinese medicine, what we're interested in is the channels that flow throughout the body and where they flow and which ones are going to come to the joints that we're interested in about. So, for example, in temporomandibular joint disorder, there's actually five, but four channels that we're going to really focus on today that supply the joint, that flow through the joint, and that connect the joint with the rest of the bodies. And those are the four channels that we need to know and be more acutely aware of to look for pathophysiology and diseases. And those four channels are the stomach channel, the small intestine, the gallbladder, and the Sanjiao, or the triple warmer channel. Next, I'm going to put up a chart that I want you guys to take a look at, and we're going to take a close look at how the different acupuncture points and channels run through the jaw. And this isn't so much so that you know which points to use or how to do this at home, but it's more for me to help you get an idea of how we think about medical problems from an Eastern perspective and how the channels run, how they connect the various internal organs to the different parts of our body, and how it creates this integrated, unified network in the body that controls our health. So here you can see this slide of the temporomandibular joint, the jaw, and the different channels that are running through it. So the first channel I want to bring attention to is the Sanjiao channel. That's going to be marked out in blue. Then the next channel that I want for you to notice is the small intestine channel, which is here in green. And then the next one I want you to see is the gallbladder meridian, which is located here in the brown color. And then finally, the stomach channel, which is located over here. So you can see in this chart how all the different meridians are running through the side of the face, the jaw, and into the joint, and how they all work together to control that joint. So a problem with any one of these meridians, the channels, or the internal organs can manifest itself on an exterior level with problems with the joint. So my main point in showing you all of these illustrations is not so that you need to memorize these points on your own, but so that you can just have a general idea of how we're thinking about things, how we view the meridians in the body as connecting the internal organs with the bones, with the joints, with the tendons, with the more superficial aspects of the body, and how the internal organs are controlling and playing a large role in all of the various aspects that we feel and of our health. And so that's kind of what I want you guys to take away from this illustration. One of the common misunderstandings that people have in thinking about acupuncture is a lot of people think that the acupuncture channels are running along neural pathways in the body, or that they're running along various vascular pathways in the body. If you look at the chart that I'm just putting up here, you can clearly see that these channels are not running along neural pathways. They're not running along vascular pathways. These are separate, independent acupuncture meridians and channels from Chinese medicine. All right, so as you guys can see from the chart that I showed, there's multiple organs and channels that are supplying the temporomandibular joint. And you might be wondering for yourself, what does the gallbladder have to do with the temporomandibular joint? Isn't the gallbladder located right by your liver, inside your abdomen? Like, what does that have to do with the temporomandibular joint? Or similarly, what does the small intestine have to do with the temporomandibular joint? That's also located in your abdomen under the diaphragm. That's what's responsible for a lot of our digestion, isn't it? So why does the small intestine have anything to do with our temporomandibular joint? And that question is answered by the relationship of the internal organs in Chinese medicine with these superficial channels and their meridians. So in Chinese medicine, each internal organ connects with a channel that runs throughout the body. There are 12 internal organs, and they correspond with 12 channels in the body. There are 6 channels that run between the head and the arm, and then there are 6 channels that run between the legs and the head. And together, those are the 12 channels that run throughout the course of the body, and they connect with the 12 organs inside our body. So these acupuncture channels that are associated with each of the 12 organs, they run deep inside the body to connect with the organs, but then they also run much more superficially on the surface of the body to spread out throughout the whole body. And it's usually on those superficial areas where they're running that we do the acupuncture points. That's usually where we insert the needles. That's the easiest place to access the acupuncture channels. And when we insert the needles into the channels at those superficial points, it then connects to the rest of the internal organ and the rest of the channel. And that's how the acupuncture makes an effect on the internal organ and on our health. Understanding this is really important to understanding the difference between the Western and Eastern perspective. So, for example, in temporomandibular joint disorders, when we think about it from a Western perspective, we're thinking about problems with the mandible or problems with our teeth, malocclusion. We might be thinking about problems with the joint capsule or the temporomandibular ligament. We're thinking about things that are very locally present, problems that are anatomical, that we can see, that are right next to it. But what we're missing, which we can see in the Eastern perspective, is that the whole body is connected. So the temporomandibular joint is not just affected by the local ligament or the local bone or capsule. It's affected by the gallbladder, by the small intestine, by the Sanjiao, the triple warmer meridian. There's multiple internal organs that are connecting to it, that are supplying it, and anything that goes wrong with one of those organs can affect the temporomandibular joint. So there's a big difference in how we view it from an Eastern perspective because of the understanding of the acupuncture meridians and the channels and their course throughout the whole body. This is also why when you go receive acupuncture, you might get points that are not nearby the place that you might have symptoms from. So, for example, in my clinic, patients come in for temporomandibular joint disorders, and I use points on the leg because the gallbladder meridian, which goes to the temporomandibular joint and is one of the most important in temporomandibular joint disorders, flows throughout the entire body from the head down to the legs. It goes down the lateral side of the leg, and there are certain key points along the leg portion of the gallbladder meridian that can really connect well and help the temporomandibular joint. So now that you guys know a little bit about what acupuncture channels are, I want to give an illustration of the small intestine channel so that we can get a better grasp of what an entire channel looks like from beginning to end and how it connects to the temporomandibular joint specifically in our case. So the small intestine meridian, it starts at the pinky finger, right at the corner of the nail on the ulnar side. And this is called small intestine number 1. We usually use a number designation, so this is small intestine 1. And from there, the meridian's going to go along the side of the hand, and it goes upward along the inside of the forearm, and it passes the elbow, and it continues up kind of towards the back side of the upper arm, where it goes to the back of the shoulder. And there it comes to small intestine point number 10, which is just under the scapular spine. And you can feel that point by lifting your arm a little bit. You can feel that point right behind the scapula. That's small intestine 10. Now, the small intestine, then it kind of zigzags across the scapular spine along the upper back. And then after it crosses the scapula, it connects with the due meridian along the spinal canal. And from there, there's a branch that goes down toward the heart, connects with the heart, and then from the heart, it goes downward through the esophagus, the diaphragm, the stomach, and then it comes to the small intestine. Now, that connection that the small intestine makes with the heart is really important in Chinese medicine because it connects the heart organ with the small intestine. And in Chinese medicine, the organs also work in pairs, and the heart and the small intestine is one paired organ that works together. So that's an important connection to make. Now let's keep going. From the neck region at the supraclavicular fossa, another branch from the small intestine meridian goes up the side of the neck just behind the sternocleidomastoid muscle, and then it finally divides into 2 branches from there. And one branch goes right below the eyeball and to the lateral side of the nose and the inner eye, and it connects to the next meridian, which is the urinary bladder. But the second branch, which is the one we're particularly interested in today, that branch travels along the outer portion of the eye, and it then goes backwards to the ear, and finally it ends at the point small intestine 19. And that's the point that's pretty much right over the temporomandibular joint. So as I went through this whole thing, you can see how one channel, like the small intestine, has multiple connections. It connected with the heart organ. It connects, of course, with the small intestine. It connects with the due meridian along the back. It connects with the urinary bladder along the inside part of the eye. It connects with so many different parts of the body, and of course the temporomandibular joint. And all of these connections show how the whole body is integrated and how the small intestine is working just hand in hand with all these other organ systems together. Okay, now that we have a basic understanding of some of the physiology in Chinese medicine of the temporomandibular joint, I want to talk for a few minutes about just some of the symptoms and how we interpret it from an Eastern perspective. Now, all of these symptoms can be associated with any number of disorders. So, the things I'm about to talk about are just as an example. They don't necessarily mean that if you have this symptom, it's caused by this disease. These are just illustrative. So I'll talk about, first of all, the symptom of joint tenderness or pain in the joint that you can have with TMD. Um, in temporomandibular joint disorder, a lot of patients have pain right in the joint, around the jaw. And in Chinese medicine, this can sometimes be because of poor flow of the qi or the blood in the channels. So, in normal health, the qi and the blood of the body is going through the channels, it's going through the meridians, it's circulating through all the organs very smoothly, there's no disruptions. But what can happen because of a whole host of different problems is that that blood flow, that qi flow, starts getting choppy. It starts stumbling as it goes through the channel. It doesn't flow smoothly. It's kind of like if you had a car and it just started hitting all these bumps as it went away, as it went along. And that's kind of what can happen in the body with the qi and the blood that's flowing through the channels. It can get stagnated. And when that happens, it can cause tenderness, it can cause pain because all of a sudden the joint is now not receiving and having the smooth flow of the qi and blood that it needs to function in a healthy manner. Another symptom in temporomandibular joint disorder could be a clicking or popping sound. A lot of patients with TMD have this popping sound when they open or close their jaw. Sometimes in Chinese medicine, that type of a symptom is associated with problems with water metabolism. And one of the channels that go through the jaw there, the Sanjiao or triple warmer meridian, is especially associated with water metabolism in the body. So that could be related to a problem of water metabolism in the body, for example. So we're finally at the point where we're going to talk a little bit about treatment from a Chinese medicine perspective. And the two treatment modalities that I tend to focus on for my clinic is acupuncture and herbal medicine. There are other treatment modalities in Chinese medicine, but these are the two big ones that I focus on in my clinic. So we're going to talk a little bit about acupuncture points, and then we're going to talk a little bit about some of the herbal treatment options that are out there. Now, just like I've said before, these are all illustrative. Everyone's case is different from one person to another. In fact, I rarely give the same treatment to two different patients. Almost everybody has somewhat of a unique presentation that's unique to their own physiology and their own problem. So we'll start off with acupuncture first. So when we're using acupuncture for Chinese medicine treatment, what we're doing, like I said before, is we're accessing the superficial channels of these internal organs and their pathways to effect change inside the body. So let's take a look at this chart and look at some of the different acupuncture points that are associated with the temporomandibular joint. So the first point that I'm going to point out to you guys is it's a crucial one. It's small intestine 19. The Chinese name for this is Tinggong, which translates to auditory palace. And this is a point that's located between the tragus and the mandibular joint. And I will usually ask the patient to just slightly open their mouth so that you can see where the depression is, and that's usually where you want to put the point in. Now, Tinggong is the last point on the small intestine meridian, just like we went through the whole channel. It's the last point, and it connects with the two neighboring points, which is gallbladder 2 and Sanjiao 21. And small intestine 19, along with these other 2 points, gallbladder 2 and Sanjiao 21, together, those 3 points have a big influence on the ear, the jaw, and the neuromuscular function of the temporomandibular region. So there are local points that we use, which means they're pretty close in location to wherever the disorder is. But we also use distal points in Chinese medicine because other areas of the body along those channels are specifically indicated and have special functions that can help affect the organs. And so we use what we call distal points as well, which means points that are a little more distant from wherever the problem may be located. So let's take a look at this chart. And this is the gallbladder channel, gallbladder 41, which is between the fourth and fifth metatarsal bones on the top of the foot, the dorsal side of the foot. And these 2 points work synergistically. And this is a really great combination for temporomandibular joint disorders because, as I showed you earlier, the gallbladder and the Sanjiao are two meridians that go directly to the temporomandibular joint region. And so this point that you use together can really impact and have a good effect on improving temporomandibular joint symptoms. So that was a little bit about acupuncture as a treatment option for Chinese medicine. And the second modality I want to talk about is herbal medications as a treatment in Chinese medicine for temporomandibular joint disorders. And like I said, these are the two primary modalities I use in my clinic, and I definitely recommend both for all of my patients. From an herbal standpoint, there is a myriad of different herbs that we use for temporomandibular joint disorders. I'm going to give you an illustration. The formula that I want to talk about is a formula called Du Huo Ji Sheng Tang. And this is a formula that was written a long time ago. It was written about 650 AD in a classical medical textbook in Chinese medical literature. And this formula is especially noted to help a number of different things, and also temporomandibular joint disorder caused by too much water metabolism problems in the body, and also a disorder that we call wind in Chinese medicine, when you have too much wind in the body. So this formula, it's a complex formula. It has 15 different herbs in it, and I'm going to just talk about a couple of them, Du Huo and Sang Ji Sheng, and those are the two primary herbs in the formula. And what this formula is mainly doing is it's trying to get rid of some of the problems with water metabolism in the body, and something else that we call wind in Chinese medicine that can cause problems in the body and cause pain symptoms. And so that's what this formula is really trying to do. So if I have a patient who matches that condition, then this is something I consider. And like I said, Du Huo, that's one of the herbs that helps improve the water metabolism in the body. If you have too much excess water that's causing problems in joints and problems in the temporomandibular joint, from an Eastern perspective, this is an herb we use. And then the second herb, Sang Ji Sheng, is an herb that can help to strengthen the liver and the kidneys, and it also helps strengthen the tendons in Chinese medicine. And so both of those herbs together, along with the other herbs in this formula, can make a really powerful combination to help temporomandibular joint disorders. Now, for most patients, I'm going to modify this to some extent, or I might even use different formulas entirely, just depending on what each patient's body constitution is like, what their relative weaknesses are, what the disease looks like for them. So we rarely just use a cookie cutter approach. Every patient's going to be somewhat different. But this is an example of an herbal formula and a couple of different herbs in that formula that we use in Chinese medicine to treat TMJ disorders. And then the last thing I'm going to talk about today is actually a clinical trial that was recently published, and it was looking at Chinese medicine and especially acupuncture for the treatment of temporomandibular joint disorders. And the study is from the QJM International Journal of Medicine, published in 2024, and it was looking at TMJ dysfunction and acupuncture. And the title of this article is Effect of Acupuncture for Temporomandibular Disorders, a Randomized Clinical Trial. And what these researchers were looking at was two key questions. Can acupuncture help reduce pain intensity in TMJ? And how well does it perform compared to a sham acupuncture? And so what these researchers found was that yes, acupuncture did help temporomandibular joint disorders, and the patients who received real acupuncture, even compared to sham acupuncture, had improvement in pain scores as well as jaw function. So they concluded that acupuncture is helpful for temporomandibular joint disorders. That's all for today, guys. I hope this talk gave you a little bit better understanding of temporomandibular joint disorders, how we view it from an Eastern perspective in Chinese medicine, and maybe a little bit of insight into how I tend to think about it from my clinical perspective and from my years of experience treating temporomandibular joint disorder. So if you found this talk helpful, please check us out for more information at houstonacupuncture.com. Please subscribe and stay in the loop if we have more videos coming out and how acupuncture and Chinese medicine can help other disorders. We'd love to see you and connect with you, and we'll see you next time.